Good morning, Instagram. Welcome to the PT on Ice Daily Show. My name is Julie Brower. Super excited to be chatting with you all today on Jerry on Ice Day. So first and foremost, we will go over what is going on right in the beginning of 2023 with the MMOA crew. Things are popping off. January is going to be super busy. So January 4th is the beginning of our next 8-week online cohort for Essential Foundations. And then if you've taken Essential Foundations, Advanced Concepts is starting on January 12th. On the road, we have 5 live courses going on in January. So January 14th and 15th, we are in California and Tennessee. And then January 21st and 22nd, we are in South Carolina and California again. So you West Coasters, you're super lucky. And then January 28th and 29th, we are in Tennessee as well. So if you live in either California or Tennessee or near those areas, you are super lucky because we are there twice in January. Okay, diving into our topic today. We are going to go through one home health hack that improve your clinical efficiency and your patient's self-efficacy. One hack that does both. And that is calling the doctor during your visit, not during your drive time. Calling the doctor during the visit, not during the drive time. Many of you are probably like, wait, but calling the doctor during my drive time is how I stay efficient as a clinician. But I want you to think about it. Like, I really want you to think, like, play this case out, team. Is it really efficient? Let's just think about how this actually plays out. How many times during that drive do you actually get through? Like, do you actually get to talk to someone? Let's say you've got 10, 15, 20 minutes to drive to Betty's house. Sometimes it takes at least 10 minutes to get through like the 5 automated messages sections, and then you gotta wait on hold, and many times you realize that you gotta hang up and call a different number. I mean, many times you're like, well, I'm at my patient's house now, and you have to just leave a message and you have to wait for someone to call you back, which can be days or potentially never. So really, you're thinking, well, now I have to go through this process all over again, right? Once you get home, if you remember, if you have the energy to do it at the end of the day. If you are lucky enough to get someone on the phone, how does that go? They ask you all this information, last name, date of birth, that now you have to drive and talk on the phone and grab your tablet and look up all this information, which is not very safe, and I highly don't recommend that. Many times they are asking questions about your patient that maybe you don't know, you can't answer because the patient is not in front of you. In addition to that, you are only explaining what you think is pertinent to the case, right? Like what your perception is of what's important without any input from the patient. So, before we talk about why doing this during the visit is going to improve your patient's self-efficacy, you're probably thinking like, well, wait, then what do I do during my drive time? I'm not going to go into this in depth because I did a whole podcast on it, which I will put that link in the comments. But I highly suggest that drive time, that 10, 15, 20 minutes, is the time when you gather your subjective from your patient. You're on your way to Betty's house, you call her up, you get all those questions out of the way so that when you walk in the door, you're ready to roll. Remember, if you all are in home health and you're on a point system, drive time should be money-making time, guys. I know so many of you, like that is sacred time where you listen to a podcast or you listen to some music. It's maybe the only quiet time you have during your day. I completely understand that. However, when we use that time to like zen out and listen to music and all of that, and we're not doing something productive, like gathering our subjective, dollar bills are literally flying out the window. When you gather that subjective, your visit becomes way more efficient. That means your hourly rate goes up. I will link that podcast so you all can dig into that a little bit more. Okay, moving on. You show up to Betty's house. Let's say you gathered your subjective. You're ready to roll. Maybe something came up during that subjective on the phone that you're like, this is something that the doctor should know about, right? And you're going to tell Betty, we are going to call the doctor together when I arrive. Or you're in your visit and something comes up, right? Something comes up that you need to tell the doctor about. And this list can just go on and on and on. So what are those things? They happen day in and day out. Betty's vitals are totally out of whack. Betty's medications are a complete disaster. Betty is having some concerning symptoms and she really wants the doctor to know. Betty told you that she had an appointment with her doctor, but she can't remember what the doctor said because he or she was talking so fast, but she knows that there was really pertinent info there. Maybe it's a situation where Betty has been non-weight bearing for 4 to 6 weeks, maybe after a fall and a non-complicated fracture, and it is time to get those weight bearing restrictions discharged, and you and Betty want to advocate together to get those restrictions discharged. By no means is this an exhaustive list. You all can probably think of 10 plus more scenarios where you are having to call the doctor. And typically, what are we doing, right? We're calling on our drive, which we already talked about can be unsuccessful. You're going to have to do it a second time. We already talked about how it's more efficient to get your subjective while you drive, or you're doing this when you go home. At the end of the day, you're exhausted. You want to make it a 5 p.m. CrossFit class, but you need to call the doctor and tell them about all the stuff going on and make sure that you get that pertinent info in before the office closes. I'm telling you, the better way to do this is to make that call during the visit. This can be a massive opportunity to empower your patient by contacting the doctor together. It becomes a collaborative effort to advocate and voice concerns. Now Betty gets to express her concerns, and you are being the guide. Too often, our patients are passive recipients to their plan of care versus active participants. They are passive recipients versus active participants, and we want our patients to become active participants for their plan of care and beyond their plan of care when they're no longer with us. So, how would this play out in a session? So you go ahead, you get started with your session, you call up the doc, you put it on speakerphone, right? We already talked about how you're going to be waiting around a little bit. In no case ever have we ever just called the doctor's office and we get a hold of the right person right away. So you're on speakerphone, just get started with your session. We're going to be waiting a little bit. However, I guarantee you, when you get someone on the phone or you leave a message and you say, I am with Betty right now, and Betty is having some concerns and we would like to speak to someone as quickly as possible. That is going to get you to the right person a lot quicker than if it was just you calling the doctor's office. Okay, now you get the PA, the nurse, you get the right person on the phone, and now Betty gets to practice expressing her own concerns. She gets to talk about what is going on. She gets to explain her symptoms and get practice explaining her symptoms with you being the guide. We know what's going to be really important to the doctor and what they are going to be looking for. Betty doesn't know yet. This gives her an opportunity to practice and you giving some tips, and you can kind of fill in some phrases for Betty if she forgets pertinent information. Additionally, there may be some information that the PA or the nurse or somebody wants that we just don't know. Maybe it's past medical history that we don't have front of mind that Betty or Betty's caregiver can help answer. The best thing here is that now it's not just us explaining what we perceive is important. Now it's Betty through Betty's scope, Betty's lens, explaining what about the current situation, her medical condition, her vitals, the way she feels, her symptom behavior. She is explaining what is important. And that's truly what matters. Maybe this isn't calling the doctor. Maybe this is taking time during that session to show Betty how to go into her MyChart and send a message to the doctor. And again, you're being a guide, talking about symptom behavior, what's important. This is a learning opportunity for Betty, an amazing learning opportunity for Betty. Imagine if you continue this process over time. Every single time that there's something important that the doctor needs to know about, Betty is learning to advocate for herself. We don't want Betty to rely on us forever, you guys. I mean, think about when we do manual therapy, right? Or we give an HEP. The idea is that those folks don't keep coming to us forever. We are teaching them how to do their home exercise program. We're teaching them, yes, here's this hands-on manual stuff, but you got to go load it to actually make a change in your tissues and to make them more resilient. We are doing the same thing with our older adults in the home. We need to give Betty the power to be able to manage her chronic disease, to be able to advocate for herself. We're not going to be there in a matter of 4 to 6 weeks anymore, right? We're going to be discharging her. We want Betty to be able to manage this on her own. Yes, we fight for our patients day in and day out, but what is more important is that we teach them how to fight for themselves. And that is what calling up the doc, having those conversations collaboratively with Betty in the room can do. Also, again, to go back to efficiency, y'all, this is good news for us as clinicians. If we can really hit on these things to improve our efficiency, our day is done earlier, we have more energy, our hourly rate is higher, we get to get more of our time back, more of our life back to spend with our partners, to spend with our kids, to make it to that 5 p.m. CrossFit class. It is a win-win for us and our patients. Okay, that's all I got for you. Have an amazing rest of your Wednesday. I will go ahead and make sure to put in the other podcasts I talked about, all about gathering the subjective on the phone and what that looks like. And we will talk again soon.